When we decided to switch from a traditional fee-for-service type model and went to DPC, the first thing we did was we wanted to test it out. So our board president, myself, and our HR director went and spoke with the DPC folks and actually became members and went through that experience. And what was absolutely, and I can't use a better word, but shocking was I spent 30 minutes with my provider, probably 45 minutes with my provider. And I got up after about 5 and he's going, "Where are you going?" I said, "Well, it's probably done with the appointment." He goes, "No." And we had a conversation about my health and what I needed to do to continue that. And that really impressed me. It's like taking healthcare back 25, 30 years to where it used to be that relationship with your physician. And at that point, we knew it was going to be a good offering for our employees, and that's what we did. The biggest gap, I think, was that service aspect. Right place, right time care is something as a provider group we really want to get to. We know that the cost of healthcare can be contained or decreased if you go to the right spot at the right time. And a great example is we have a tremendous number of young employees, and the young employees have children. In the middle of the night, the kids get ear infections and things like that, and you don't know where to go. Yep. So you go to an emergency department. Well, that's $5,000 just to walk in. Whereas we went right to DPC, it was taken care of. We saw tremendous savings just in that first year with folks just taking advantage of that part of the DPC program. We've had a really big struggle with that starting about 5 years ago. We did, I should say. And the struggle was over the rising cost of healthcare. We had to do something, and that's where DPC came in. Our broker said, "Hey, you should try this model." And we were a little skeptical, so we tried it. And each year we've seen a decrease in expense as people utilize it more. And of course the service and the quality's been off the charts. People go and they're a little hesitant because it's free, you know, and they go and they come back and they're like, "That was great. It really was. I didn't have to pay anything." It's like, well, yeah. So yeah, recruiting's been much better since that. We've seen a higher engagement with DPC since we started. I want to say the first year it was in the 20% range, and now we're up about 40. We really want that at about a 60% clip. We've seen folks that have return appointments. We can tell by our data that folks in our cohort in our company that have diabetes or have high blood pressure or have whatever are having those follow-up appointments with the physician. And when they're able to have more follow-up appointments because they know it doesn't cost them X per copay, guess what? Other healthcare things are caught earlier, and we're hopeful that in the future that's going to curb the cost and keep people a lot healthier. I think it's where it's going. I think that the traditional fee-for-service model doesn't work. We have a unique perspective in being both a provider of healthcare and an employer. So when we take our employer hat on and look at our provider hat, we know what we pay in premiums, we know what we get reimbursed from the insurance company, and we know that middle ground, it needs to be reduced. We need to bend the cost curve. And as an employer, if we're able to do that, which we are, then we can hire more people, build more buildings, provide more care. And I think as people understand what direct primary care is and they utilize it more, we're going to get a tremendous engagement, and that's going to do nothing but help out with healthcare.